We were wrong when we thought the earth was flat. We were wrong when we thought computers were just a fad. We were wrong when we thought the use of restraints was good. And we've been wrong in our thinking about mouth care too. For years, we've approached mouth care like a grooming activity, no more important than brushing hair or shaving. Now we know that mouth care is not grooming, but is actually a vital part of infection control and health promotion. To be blunt, if we don't provide mouth care every day, there'll be serious and lasting health consequences. On the other hand, if we do provide proper mouth care, we can improve the quality of life and reduce the incidence of pneumonia, hospitalization, and even death. Welcome to Mouth Care Without a Battle. This is Module 1, Mouth Care Basics. It teaches the techniques of good mouth care based on proven best practices. The module has 2 parts. Part 1 teaches the basic steps in mouth care, and Part 2 teaches you to deal with a variety of special situations that you may encounter in mouth care, such as denture care, missing, loose, or broken teeth, and caring for people with swallowing problems. After completing this module, you can apply for 1 hour of continuing education credit. Okay, so let's be honest. You're thinking, oh no, I'm going to sit here for an hour while this woman tells me how to brush teeth? I've been doing that my entire life. Well, let me reassure you. There are techniques and products for toothbrushing, flossing, and gum care that I know you're not using, because I wasn't using them either. And they really do make a difference, especially when you're caring for someone else, and even more so when that someone is at high risk for infection and disease. On an even more basic level, let's imagine for a minute that you have a piece of food stuck between your teeth. You can feel it, and it's uncomfortable. You'd want to get it out, wouldn't you? What if you couldn't? And what if you couldn't brush your teeth at all? Over time, your teeth might start to look something like this. Sadly, these are the mouths of nursing home residents. But by following the techniques presented in Mouth Care Without a Battle, you can help teeth that looked like this start to look like this. You'll also reduce the risk of pneumonia and heart disease and improve diabetes control and food intake. And further, the people you care for will feel better on a daily basis.
You're so much better.
Oh, good.
Oh, boy.
Give us your best smile. There you go.
All right.
All right.
What are the techniques? Simply put, mouth care can be boiled down to 5 steps. First, remove leftover food from the mouth. Second, brush the surfaces of the teeth. Third, clean between the teeth. Fourth, brush the tongue. And finally, apply a fluoride paste to protect the teeth. Simple, right? Now let's get into the details. First is to get leftover food out of the mouth. For this, use a piece of gauze dipped in water. Squeeze off the excess liquid and wrap the gauze around your gloved finger. Feel around the cheeks for extra food that may be trapped, and use the gauze to remove as much of it as you can. This will allow you to brush the teeth without food in the way.
Oh, you damn good, Big Dad. How'd that feel?
Next, it's time to actually brush. Here, on a large model, we demonstrate proper brushing technique. Believe it or not, there really are right and wrong ways to brush teeth, which many of us don't realize. Here's one way to do it right. To brush the sides of the teeth, hold the toothbrush at a 45-degree angle to the gum line. Jiggle the toothbrush back and forth, then sweep the plaque away from the gum line. The plaque is a collection of bacteria that attach to the surface of the teeth, usually along the gum line. If you brush the teeth right after the plaque begins to form, it's soft enough to come off with the toothbrush. If you wait, though, it starts to harden within 48 hours, and in 10 days it becomes a hardened dental calculus, which is difficult to remove. That's why we jiggle and sweep, brushing both the insides and the outsides of all of the teeth. Brushing like this is important because it's the motion of the brush, not the toothpaste, that cleans teeth. So remember, jiggle, sweep, jiggle, sweep. Your sweeping motion is removing the soft plaque. Over time, the bacteria in the plaque attack the gum tissue, causing gum inflammation, also known as gingivitis. You can recognize gingivitis because the gums are red or reddish blue from inflammation, and they're tender and bleed easily when you brush. Gum disease can cause teeth to loosen as well as fall out. And very importantly, plaque bacteria can infect other parts of the body, especially the lungs. Did you know that aspiration of plaque bacteria is one of the most common causes of pneumonia in nursing homes? As I said when we began, mouth care is a vital part of infection control. After cleaning the outsides of all of the teeth, brush the biting surface using short back and forth strokes. Be sure to brush behind the last tooth on each side of the top and bottom. The far back is commonly missed while brushing, causing significant plaque buildup. Now that you've learned how to brush, let's talk about what you brush with. There are many options for products and pros and cons for each one. We're going to focus on 5 products, but you should consult with a healthcare professional when deciding which ones to use. The first product is toothpaste. Some toothpastes have fluoride, which can help reduce tooth decay and cavities. Most people are accustomed to using toothpaste and like its fresh flavor. However, the foaming action of toothpaste can cause some people to cough or choke, so it should be used with caution or avoided altogether in people with swallowing problems. Also, since toothpaste requires the person to swish and spit, it's not appropriate for people who can't follow directions well or who aren't able to swish and spit, such as many people with advanced dementia or stroke. The second product to consider brushing with is water. It might sound strange to only use water, but remember, it's the motion, not the liquid, that removes the soft plaque. So dipping the toothbrush in water will often work just as well as applying toothpaste to remove plaque. And there's less chance of the person coughing or choking if you use water. Many of you may be familiar with a third product, Listerine, but I bet you don't brush with it. Alcohol-free Listerine is a great product for brushing as it kills bacteria and is safe for daily use and doesn't foam like toothpaste. Another similar product is Biotene Rinse. It's also alcohol-free and is especially helpful for people with dry mouth. The last choice I'll mention for toothbrushing is an antimicrobial rinse, like alcohol-free chlorhexidine. Chlorhexidine kills bacteria and reduces gum inflammation. It's a prescription product that has to be approved for use by a physician or dentist. If you do use it, we recommend that you use it for only 6 weeks at a time, which is all the time it takes to get gum inflammation under control. After that, switch to another product, such as toothpaste, water, Listerine, or Biotene Rinse. When deciding which product to use, consider the person's ability and needs. Is the person at risk for choking? Does she have a problem with dry mouth or gingivitis? Here's a chart that summarizes the pros and cons of each of these products, and you'll be able to print out this information later when you finish this module. For more detailed tips and product information, visit our website. Next, let's talk about toothbrushes. Fortunately, the only real decision to make when choosing a toothbrush is color. Other than that, the toothbrush should have soft bristles because hard bristles can scratch the teeth and injure the gums, creating more places for bacteria to grow. If you like, you can use a smaller brush called an end-tuft brush to get to hard-to-reach places. An end-tuft brush or even a children's toothbrush can be useful for people who can't open their mouth very far. Do keep in mind the toothbrushes wear out and must be replaced every 3 months or when the bristles become worn or frayed. When a toothbrush looks like this, it can no longer remove soft plaque from the teeth. Now, as good as brushing is, it doesn't get in between the teeth. That's why we're supposed to floss. For the people we take care of, cleaning between the teeth is especially important to remove old food particles, plaque, and bacteria. Knowing that it might be dangerous to stick your hand inside someone else's mouth to floss, we instead recommend the use of an interdental brush, also called a go-between. It's made to safely and effectively reach those tiny spaces between the teeth. An underappreciated part of mouth care is cleaning the tongue. Just like the rest of the mouth, the tongue has bacteria on it, which is a common cause of bad breath. Some people may even have a heavy coating on their tongue, or their tongue may be discolored. There are 2 easy ways to clean the tongue. The first is a toothbrush. To brush the tongue, dip the brush in whatever you use to clean the teeth. Starting at the front of the tongue, brush forward in short strokes. Slowly work your way to the back of the tongue, but be careful not to make the person gag. Some toothbrushes even have a tongue scraper on the back. Many people don't even know what this is. I sure didn't. If the toothbrush you're using has a tongue scraper, by all means, try it out. For people who can't open their mouths wide, there's another option to clean the tongue. Use a gauze pad dipped in water, Listerine, Biotene, or chlorhexidine. Wrap it around a cotton swab and rub it along the tongue. The final step in cleaning the teeth is helping to protect them from cavities. You can do this by applying a high fluoride paste or rinse to the surface of the teeth and along the gum line, as shown here. We used a prescription-strength fluoride paste, but you can also use an over-the-counter product. Now that you know what supplies you need to provide mouth care, let's talk about how to organize and store them. In addition to the toothbrushes, go-betweens, and toothpaste or rinses, your setup will include disinfectant wipes, gloves, gauze pads, cotton tip applicators, a clean towel, and medicine cups. If you don't have a storage plan, here's what can happen.
So where is that denture cup?
Clearly, it pays to plan ahead. One way to organize your supplies is to store them in a safe place in the person's room, such as an in-room medication cabinet or a locked cabinet in the bathroom. If this isn't an option, you can take a mobile cart from room to room. Obviously, if you're using a mobile cart or similar shared system, you'll need to keep each person's own supplies from touching another person's supplies. Plastic file folders can be helpful, each one labeled with the person's name. Of special consideration is that the toothbrush will need to air dry. To do this, use a toothbrush cap that has holes to allow for drying. Now that you have your supplies organized, it'll be easy to set up for daily mouth care. The first thing to do is sanitize the work surface. For this, an antibacterial wipe works great. Once you've disinfected, it's time to get your supplies ready. Keep in mind that the supplies you use and the way you set them up may vary depending on the products you're using. We like using disposable paper trays to set the supplies on. First, the caregiver sets up 2 medicine cups, gauze pads, and a cotton tip applicator. On one corner, she places a pea-sized drop of the prescription fluoride paste. If you're using a fluoride rinse instead of a paste, pour a small amount of that into a medicine cup. Next, she readies a cup for the person to spit in. Then she pours chlorhexidine rinse into one of the medicine cups. She'll use this to brush the teeth. In the other medicine cup, she pours Listerine for cleaning the brushes. She then places a towel over the person to protect her clothing. The caregiver then thoroughly cleans her hands with a sanitizer, lets them dry completely, and then puts on her gloves. Now that her gloves are on, she prepares the person's personal supplies by setting them on the paper tray. And now she's ready to provide care. Let's watch as the same nursing assistant performs mouth care from start to finish. In this clip, the caregiver has already prepared all the supplies she'll need except the individual's personal supplies. The caregiver begins by putting on her gloves and getting this woman's personal supplies out. She removes the toothbrush from the aerated cap and places it on the tray, and then does the same for the Endtuff brush as well as the interdental brush. Once ready, she explains what she's about to do.
Miss Roster, I'm getting ready to get started. I want you to start off for me, okay?
Since the woman is able to provide some of her own care, the caregiver encourages her to brush her teeth once she's dipped the brush in antibacterial rinse.
Go ahead and brush. It's okay. Go ahead and brush.
While this woman may not be brushing perfectly, it's important to let people do as much as they're able. You can go back and brush areas that might have been missed.
You're doing a good job. Miss Roster, let me help you out. Let me help you out, okay?
The caregiver let her know that she was going to help finish the cleaning,
I'm going to the bottom of your teeth, okay?
and she let her spit when she needed to.
Thank you.
Next, she dips the toothbrush in the antibacterial rinse and gets rid of the excess on a gauze pad.
You're doing a good job.
While she's brushing her teeth, She's explaining exactly what she's doing. She also makes sure to rinse off debris and dip the brush in chlorhexidine rinse every so often.
Good job.
You can notice that she brushes the teeth using the jiggle sweep action we've learned. She continues brushing until she's brushed all the surfaces of the teeth. Now the caregiver continues brushing to make sure she's brushed all the areas she needs to and keeps explaining what she's doing along the way.
I'm brushing the top of your teeth, okay? Open your mouth for me. Thank you.
Now that she's finished with the toothbrush, the caregiver switches to the end tuft brush to clean some of the more difficult to reach areas. If you don't have an end tuft brush, you can use a standard toothbrush to reach those areas. Now that the caregiver has finished brushing the surfaces of the teeth, she'll use the go-between interdental brush to clean between the teeth. Again, she explains what she's about to do as she does it.
Relax, sweetheart.
As she cleans between the teeth, she wipes off food and other material on the gauze pads and cleans the interdental brush and antimicrobial rinse. She then resumes cleaning between the teeth with the interdental brush.
Okay, you're doing good.
Here, we see a close-up of the interdental brush cleaning between the teeth.
Relax, you're doing good.
When she's done, if the person is able, she can rinse her mouth out with water.
This is some water. You need to spit first? Okay, spit first. Okay. And you take this water and gargle your mouth out for me. All right.
Next, the caregiver will put the prescription fluoride paste on her teeth. This is especially useful for people at high risk for developing tooth decay and cavities. The caregiver applies the paste with a cotton tip applicator to the tooth surface right along the gum line. Note that she dips the applicator back in the paste from time to make sure all of the teeth are covered. Once she's finished, she just needs to do one last check of the inside of the person's mouth.
Miss Royster, let me check in the inside of your mouth, make sure I got all the food out, okay?
The caregiver gently sweeps her finger through the mouth to check for other food or irritation in the gums, cheeks, and tongue.
You did a good job, Miss Royster. Okay? Thank you so much.
Again, she allows her to spit. For many older adults, swallowing is difficult, so you should be particularly conscious of allowing them to spit when they need to. Periodically, a nurse supervisor or other healthcare provider should check the health of the person's mouth. Module 3 provides additional information for nurse supervisors. As you can see, these checks take only a few seconds, but can identify small problems before they become big ones.
Oh, that looks great.
When you're done providing mouth care, the cleanup is easy. Dispose of the materials that won't be reused. Put the personal supplies away. Disinfect the person's individual container. Disinfect the work surface. Finally, disinfect your hands. Let's watch one care provider doing this. First, the caregiver rinses the toothbrush in Listerine to kill bacteria growing on the brush. She then dries the brush with gauze and places it in an aerated cap to let it air dry. Next, since she used an end tuft brush, she cleans and stores it in the same way. It's important to rinse the brushes for 20 to 30 seconds, since most antimicrobial rinses need that long to kill all of the bacteria. Once again, she makes sure to dry it well. Then she places it in a cap with holes to let it air dry. It's also important to clean the interdental brush. Again, rinse for 20 to 30 seconds with Listerine. Then dry it with gauze and place it in the case to air dry. With the person's personal supplies cleaned, dispose of other materials you used. Then take off your gloves and dispose of them. Next, clean the individual's personal supply container. Now it's time to clean your work surface. Be sure to clean the entire surface, as well as any handles you might have touched. Finally, it's time to clean your hands. Use hand sanitizer or soap and water, and be sure to clean all the surfaces of your hand, including the spaces between your fingers. If you'd like to practice some of what you've just learned, find a partner. The first thing we'll do is practice the jiggle sweep motion. For this, you'll need only a soft toothbrush and a cup of water. When you're ready, pause the program and take turns practicing the jiggle sweep brushing technique. When you're finished, restart the program and we'll talk about what happened. How'd it go? Did it feel strange having someone else brush your teeth? Did you feel nervous when you saw the toothbrush coming toward you? Many people have told us that it's a bit unnerving and uncomfortable, and that it can even hurt a little. Keep this in mind when you provide care to someone else. In terms of technique, did you master the jiggle sweep approach? If not, don't worry. Over time and with practice, it'll get easier. Now that you have the basics down, we're going to move beyond the basics and talk about how to provide care in special situations.